Bruce, you must have something really good too.
Of course I do. It's Bruce Danielson, and I guess I'm here to entertain you too.
Good to go.
Good afternoon, everybody. Welcome to everybody here and those watching at home to the Wednesday, May 6th, 2020 informational meeting. We'll call this meeting to order and start out with a report from the Metro Management Council. I believe Councilor Kiley, are you here to give us a report?
Yes, I am, and I'm just scrolling to that agenda as we speak here. We started out, we met April 22nd at 3:30, and we received the director's report, and then we approved an agreement for EMS dispatch services with Patient Care Logistics, which is a 5-year agreement, 2020 through 25. And it's going to increase the fee that we receive for these dispatch services from $20 per call to $25.31 per call over that 5-year period, which is really a good deal for both the city and the county. Because that funding helps to offset costs and then lowers the investment that the city and the county have to make. Following that item, we reviewed financial statements for the month of March, and then we approved our new 2021 budget. An executive session was listed, but none was needed. So that concludes the Metro Management Council meeting report.
All right, thank you, Councilor. We'll move on to City Council open discussion if anybody has anything. I don't see anybody here with anything. Anybody on the phones have anything for open discussion?
Not Kylie.
Okay, Councilor Staley.
I learned something this week about woodchucks. A woodchuck decided to make his home in my yard, and so I got schooling on caging animals, live trapping them. I did discover through this, because here's this woodchuck burrowing holes under my shed into my yard, eating the bark off of my tree, and I called South Dakota Game Fish and Parks, first of all, and they said, call animal control. And I called animal control, and then I was told that they no longer help us with live trapping those things, possums and woodchucks, which they made a change in the policy in February, which I didn't know. So then I had to, luckily, I put it on Facebook, and I had 2 people offer to help me with a live trap. But I had suggested to Julie DeYoung, in a conversation that we had in the last few days, that I think it would be beneficial to do an informational to help the public understand what's their responsibility in this, and also to put out some kind of a brochure to help the public also know what's the procedure for live trapping, because it's not something for the faint of heart. A friend let me borrow their live trap, and it was about this big. So Sunday, when that woodchuck was hanging around by the back door, I said, okay, this is the day. And I put a piece of muskmelon in that trap and put it out, and guess what? I caught a squirrel. And I could not get that squirrel out of there. So luckily, my neighbor came over with a big trap, and he released the squirrel. We put the trap out, and 2 hours later, we had the woodchuck. And he released it down to the river, and then he said, Kurt, you probably could have helped me with this too. Although I'm not sure you probably do the live trapping. Okay, good. But, and I guess it's illegal to do anything but live trapping in the city. See, I didn't know that. But anyway, we got the woodchuck, and then my neighbor said, hey, let's put this back up again and make sure there's no other woodchucks in that hole. The hole was like this big, tunneled from my garden under the shed to another hole. So we put it out, and guess what I found in there the next day? A big old possum. A big old possum. So we let the possum go, but we kept him in the backyard because they're supposed to be beneficial. So the woodchuck got evicted, the possum got his lease renewed, and at the end of the day, I think it would be good to have some kind of a informational effort to let the public know how you handle that. Thank you.
And we could find out how much wood a woodchuck can chuck at the informational?
You chucked a lot off of my trees.
Okay.
Yeah,
Well, there we go. Anybody else have anything? That's hard to top. That is hard to top, that one. I would just throw in, last week we had the privilege of serving at the banquet. I believe the mayor's office had arranged it, and I think there are a couple of different shifts were over there. I know on the evening shift, Councilor Starr and Councilor Erickson and myself were there, and it was the new facility on the west side. And it's really a beautiful building. It's the first time I've been in there. So it was really nice, and they've got the system down pretty slick for, obviously you have to take some precautions and run things a little differently, but went very nice, and it was, I think volunteered a time or two at the one downtown, and obviously it was a little bit different. But anyways, very enjoyable and a privilege to be a part of it, and everybody, good traffic for it, so. With that, we will move into presentations for the day. The administration's been nice enough to send somebody over every week for a COVID update, and we'll continue to do so for the upcoming weeks. And it looks like Director Franken's here for that today. Thank you.
You bet. Yeah, Jill Franken, Public Health Director, and I'm just kicking this off because Sandy Francis is going to do this presentation today, and it's really giving you an update on all the activities we have going on in our EOC from an ops perspective. And so she's going to talk through that, and then Jeff Ackoff is on the line, and he will give an update on our SOAR program. So I'm going to turn it over to Sandy.
Welcome.
Thank you. Good afternoon, Council. Am I going to be coming through okay? Am I close enough? Thank you. So I believe it was mid-October when Regan Smith, our city mid-October, oh my gosh, it seems like that, doesn't it? Mid-April when Regan Smith, our city emergency manager, came and gave you an overview really on the overall activities of the Emergency Operations Center. I think we were on like day 35 at that point of our emergency response. Today is day 59 of our COVID response operations for the Emergency Operations Center, and as Director Franken said, I'd like to provide you with a brief update focusing on the activities of our operations section of that response. So, and then of course, in addition to our command positions, which are Unified Command, Public Information, Liaison, and Planning and Finance, we do have an operations section chief and an operations section that has 6 branches supporting our current response. The first branch under operations is our public safety branch. That branch is being led by Sioux Falls Fire Rescue Division Chief Mark Bukovich. Partners that he's working with in his efforts include law enforcement, Sioux Falls Fire Rescue, EMS, Patient Care EMS Solutions, Metro Communications, Emergency Department staff from Avera and Sanford, as well as the State Department of Health. The activities that they are working on include twice daily conference calls with response partners, with those conference calls focusing on coordination and communications, meeting community response needs, maintaining responder safety, and reviewing and updating treatment protocols based on national standards of care. This group is also active in inventory management of personal protective equipment, or PPE, making sure that we do have the PPE we need to keep our responders safe as they work within our community. They are monitoring patient movement and continue to plan for resource management across the system, making sure that we have first responders and the equipment we need to serve the community as the needs arise. The second branch under operations is our Healthcare Coalition branch. So this branch is led in a partnership with the city and our local healthcare partners. So partners with those efforts include Avera McKinnon, Sanford, the VA Medical Center, Lifescape, City and County Emergency Management, and the state of South Dakota State Department of Health. So activities of this branch include conference calls conducted every Monday, Wednesday, and Friday with the focus on coordination and communications across all planning partners. The topics for those conference calls include surge capacity and alternate care sites, quarantine and isolation capability, and then other community mitigation efforts, so things around education, support of social distancing. This group also maintains an effort around inventory management of personal protective equipment. So the Healthcare Coalition has provided PPE to healthcare partners, EMS and first responders, long-term care providers, shelters and critical infrastructure service providers across our community. This group also is doing the work of supporting our COVID specimen collection activities. So the majority of those efforts are being directed through our healthcare and hospital systems through their facilities and their drive-through specimen collection sites. But this week, as you know, we did have a large community clinical specimen collection site happening over at Washington High School. Those efforts are being led by Vera McKinnon, along with support from the Department of Health, the South Dakota National Guard, the Sioux Falls School District, the CDC, a local employer, and then the City of Sioux Falls. So our focus and support in that response has been through traffic control assistance, through the police department, through access to some logistical supplies, pylons, cones, barricades, things to help with traffic management and site coordination, and then working with coordination and planning efforts across our partners within the EOC. And as a quick update, on Monday, that specimen collection site served 1,457 folks. Yesterday, 1,079 people went through that specimen collection site. So it's a fabulous community mitigation effort. The third branch under operations is our City Continuity of Operations branch. So Alicia Kalura and Bill O'Toole are leading the efforts of that branch. And the work of that branch is being conducted primarily by an internal city group that is working on focusing their efforts around continuity of services for the City of Sioux Falls, as well as the health and safety of our employees. So their planning and response efforts include such things as providing guidelines on workplace mitigation efforts. So for example, Dr. Tingley with the Community Health Center just recently recorded a video to help instruct employees on the proper donning and doffing or putting on and taking off of masks and gloves. This group is also working with enhanced communications with regards to COVID across all departments and assisting departments in providing guidance on preserving essential city functions. The fourth branch under operations is our vulnerable populations branch. So Vanessa Sweeney with the Health Department, as well as Carrie Benz with County Human Services, are leading the efforts of this branch. Partners that they are working with include City Housing Manager Shelley Unruh, Dr. Jennifer Tingley, staff at Falls Community Health, Minnehaha County Human Services, case managers from our hospital systems, as well as the State Department of Health. Planning and response efforts from this branch include provision of education and technical assistance on mitigations in support of our local shelters. They've done a lot of education and on-site training and assistance with questions on housing. They're working with community partners to provide educational materials to our vulnerable populations in multiple languages and in multiple mediums, so not just written, but also in a video format. They are advocating on behalf of the populations they serve and working with community agencies to meet the needs of our vulnerable populations, and they are putting a huge effort into planning and operations of an isolation site for our vulnerable populations that need to be either quarantined while they wait for their results or need to be isolated because they've received a positive result and they can't safely isolate where they live. That branch is currently housing 17 guests as of this morning. Last week, they hit a peak number of being able to provide services to 40 people. The capacity at the site they're using right now will go up to 63, and we're putting some backup plans into place if needed. Additional services that are being provided along with that isolation site include food services, laundry services, on-site security, as well as on-site staff and case management services to help the guests as they need to meet the challenges of being in an isolation site. And I also understand that several of the contracts for these services are on tonight's consent agenda. So as a personal point, I just want to stress how important this community mitigation effort is in protecting our vulnerable populations and trying to control the spread of the coronavirus amongst this population. The fifth branch of operations is our Community Organizations Active in Disaster, or our COAD group. So this is a group led by Janet Kiddums, and you know they rise to the top and shine every time we have a community response. So partners that she's working with in her organization during this event includes Faith Temple Church, Feeding South Dakota, Sioux Falls Schools, Boys and Girls Club, Salvation Army, Food to You, Sioux Falls Corona Help, Helpline Center, and the City of Sioux Falls. Janet and her group are really working to support the community through coordination of volunteer efforts of community partners, so such as our food distribution group that's providing food to our community on Tuesdays and Thursdays out at the fairgrounds. Yesterday, 548 households, or 3,171 individuals, were served at that site, and they will serve again and provide food again tomorrow. This group is also working with the One Sioux Falls Fund and the Unmet Needs Committee in their efforts to provide a safety net for housing needs. That group is still receiving about 50 applications a day for service. The Helpline Center is also serving as a call center to support the needs of the community. So since this response started in mid-March, they have answered 21,906 calls for service as of end of day yesterday, with those calls ranging for requests for assistance anywhere from food and housing resources, general information, disease-related information, and mental health services. The sixth branch of our operations is the Business Operations and Resiliency Group, the group we call SOAR. This group's efforts are being led by Jeff Eckhoff as well as Luann Ford. And at this point, Jeff has called in, so I'm going to turn the podium over to him to provide the update on his branch.
Is he calling in?
Jeff, we can't hear you in here.
Unmuted. Can you hear me now?
Yep.
There you go.
Okay, sorry about that. So SOAR is supporting operations and resiliency for businesses. And it really, this kind of started back when the no lingering ordinance started, and there was a partnership between Planning and Development Services and Health, and in particular myself with Luann Ford, in helping with interpretation and enforcement of the no lingering. And so as the mayor came with the SOAR program and really wanted to be more proactive to provide businesses with resources, technical assistance, and also for a place for employees that could have a place to call if they had questions or were feeling uncomfortable or just had general concerns or questions about mitigation efforts. And so we stood up the SOAR program, and it continues to be a partnership with Health, Luann Ford and her inspectors and the environmental team. And the first thing we did was we stood up a website with resources for different businesses. It had a lot of the general CDC guidances on cleaning and those types of things all in one place. Some of the city infographics, flow charts about what happens if you have an employee who's not feeling well or tests positive, things that they could readily get a hold of. And then we built out industry-specific sectors for manufacturers, grocery stores, retail, and we tried to pull in local resources, so some of the State Department of Health checklists, South Dakota retailers, some of the manufacturing groups, and really provide a centralized place for those and referrals out to other services that are available. And then last week, and through that period, with some of the work that the health department had done that was proactive, we probably had touched 100 different or 100 plus different business locations in the city at that time. A lot of them the larger ones, the big boxes, the Hy-Vees, the places like that. It provided been on site or been on the phone and talked to them and helped with assistance and questions. With the ordinance that you folks moved to second reading last week, it certainly got busier. We've seen probably, I'm at this point, I think we're probably 40, 50 new inquiries a week. And it's increasing. We can tell it's increasing as tomorrow gets closer, and people are wondering what that means for them. We are getting a lot of calls about occupancy. What's the occupancy of my building? If they fall into that part of the provision, how many people can I have? And it's really been a lot of smaller businesses too, clothing stores, restaurants, services, churches. We're getting a fair number of calls from churches as the faith community starts thinking about coming back together and holding services again. Of the calls we've received, I would say about 75% of them or for technical assistance. I'm thinking about opening up. I have some questions. This is what I'm doing. What do you think of that? Do you have any other suggestions? And about 25% are individuals who are concerned or maybe have some complaints. Those that come in where there's been a positive test, of course, we refer those directly to the State Department of Health so they can start their contact tracing with them. Those who have other, I'm wondering if this is the right thing to do. We'll just reach out to them and try to work with them and give them some ideas of what their expectations should be. And again, if it's truly a situation where it's untenable, then we refer those on to the Department of Labor, of course. We are using, and Sandy referenced 211, they are kind of our front door. We ask people, make it easy for both companies and for individuals to just call 211, ask for the SOAR program referral, let them know what they're asking for, and then those come over to us. And then Luann's team or our team takes those on. Right now, I would say probably 60% or so of our referrals are coming through 211. A lot of them continue to come through the mayor's office. I think that's what people tend to do when they have concerns is just get, our mayor is accessible, and then they email right away. And so those get passed on to us as well. But it's going well, and we're going to add some capacity. Luann's team has kind of been handling it, the load, but that we can see it ramping up. So we've got a couple of our planning development services staff that we are going to be connecting with Luann this week so they can start getting a little bit more training, and so they can be ready to assist as I really anticipate this to the demand to really ramp up next week after the ordinance becomes effective, obviously depending on what you folks pass tomorrow. With that, I take any questions, but thank you.
Okay, thank you, Director. Did you have anything else, Jill?
Sure. Thanks to both Sandy and Jeff for those updates to you. Maybe we'll have some questions, and we know in particular that there were possibly some questions about a few items that were on the consent agenda tonight. We did get an email earlier today, and so we're prepared. Jeff Helm is here from Sioux Falls Fire Rescue, as well as we could answer questions about any other items that were on the consent agenda that you may have questions about before tonight's meeting, or anything that we've shared today, or any other questions. I'll just finish by just saying you're not hearing a lot of data from me today, but I will be sharing more of that with you tomorrow morning when we have a special council meeting. So you'll get an update on that as well. So.
All right, thanks for being here today. Councilor Neisert?
Yes. Jill, I'm in looking at the consent agenda, I see there's things in here for the security and the food service of an isolation site. There's also the contract for USF, which at least, and maybe it's changed, was going to be for, I believe, first responders and maybe medical workers. But there was some discussion about hotels for the general public if they couldn't isolate. What is the status of that? Because I don't see any hotel listed.
Sure, and that's the area that Sandy can talk through, but she mentioned about, our vulnerable populations and the work we're doing to be able to effectively isolate and quarantine those populations. So I'll have her talk a little bit more about that and those items that are on the consent agenda.
Okay.
Thank you for the question. So the work for towards a second isolation site is lined up and it's ready to go. I think that it would be fair to say that the contract is kind of like in a warm holding pattern. If we need to pull the trigger on it and start isolating or expand our services from the current site that we're in, we'll go ahead and move with that. But for now, we want to focus our efforts and our staffing and our planning around meeting the immediate need of the isolation site that we now have open.
Okay, if there was somebody in a, maybe not a vulnerable population, maybe they just live in an apartment, for example, and they just needed to isolate somehow and they reached out, what would you do?
So the process that happens now is that, so if a person is tested and they test positive, the State Department of Health notifies them and does their contact tracing, and they work with the individuals to determine if there's any way for people to stay at home where their services and their supports are, recognizing that there are opportunities where people can't. So 2 people living in a single bedroom apartment with 1 bathroom, for example. So in that situation, if there isn't a family member, another option, then then a State Department of Health case manager would contact us, and we would work with the person on an individual basis and work to develop an isolation plan for them.
Okay, the Secretary of Health or the governor made some reference to that they would do that, so it was good to hear the detail of how that works. The other question I have, and I don't know if it's for you or Jill, I'll just throw it out and we'll see who'd like to answer. We've gotten, and at least I have gotten scattered messages from people that said, I went to my doctor, a loved one went to the doctor, and they said, we're not going to test you. And they felt like I should have been tested. And so who determines whether or not somebody gets tested? Is that each health system has their standards? What determines that?
So the State Department of Health at the State Public Health Lab has set up criteria for who is eligible for testing at their labs. And then our reference labs, hospital systems, are allowed to also set up their own criteria. They are mirroring what the State Department of Health is testing.
Okay, so they have,
it's really set up, the criteria for testing is based on CDC recommendations and testing lab criteria.
is it still reasonably fair to say, at one point I remember reading or hearing that whether or not you are infected or not doesn't necessarily, if you're not in the hospital, doesn't necessarily change the recommendations of what you should do at home, and so maybe it's not as beneficial, because some people felt like, I'm being told to go home and we don't know whether it's a flu or if it's COVID, and I don't understand why they won't test me. And of course, this is a doctor-patient discussion, and I don't want to invade on that. I'm just curious. So.
And I think that the statement that our physicians have made when they've come and presented with you in the past is, we treat our patients based on their symptoms and their need for care, not necessarily on the status of the test. So the care is directed based on your symptoms.
Okay, thank you.
Councilor Erickson?
Thank you. And I don't know which one of you want to answer this. And I meant to send an email, and it's amazing you have to hit the send button for it to actually go to you. So my apologies that I didn't send this to you in advance. I did have a brief conversation with the mayor this morning. But as we talk about vulnerable populations and contract tracing, one of my questions is talk to me a little bit about that vulnerable population at the Bishop Dudley House. We've seen some cases there, and I understand this could be a Carrie Benz question too, but my concern is if those patients that are tested positive are not being reported back to the Bishop Dudley and people show back up. I know they're getting a hotel, they're getting fed there, but you can't lock them in the room and say you have to stay there. And I know there's been instances of people going back, and I just really see the need that we need to make sure that they know, but I know there's HIPAA.
And that was the answer I was going to give
Yeah,
you.
so
Once the State Department of Health has the results, they'll notify the person that's positive, but because of HIPAA, they cannot release that information to the shelter.
So is there a way, just thinking outside the box, because, I mean, this is a breeding ground. If someone does go back to the Bishop Dudley House, and you have 66 men in one location, for example, it's a pretty incredible breeding ground for COVID, that it can spread to that vulnerable population pretty fast. Is there something that could be done? Is a single pager could be given when they're signed into their hospital, or excuse me, into their hotel, and said, we'd like to report this back to the Bishop Dudley because we understand that you are, and they could freely do it or not do it. I could say, I'm not signing it, or the next gal or guy may say, yeah, I'll sign that, just for more information.
You know, I think I'd be willing to take that conversation back to the vulnerable populations group. I mean, if I as an individual choose to release my status, I can do that.
Right.
The state cannot, but that would be really in operations within that branch, and I'm happy to take that back.
Yeah, that would be great. Just, and my thing is, I don't want anyone to feel forced that is your right, my right to not share. But if, hey, when you check in, would you mind if we send this, because we know that you're a, frequent user of said place, just so we're protecting the other people.
I'll bring that back to the group.
I don't know. I just would be curious on how that would work. So that's my question. Thank you guys again for all the work that you're doing. I know it's, you're flying by the seat of your pants and really making changes as fast as you can. So thank you for all the work you're doing.
Councilor Staley?
I've got quite a few questions here. First of all, for Jill or Sandy that came up today, how much does a COVID test cost? And well, I mean, we're talking about doing these tests, and then And I understand that, you know, if you have health insurance, I mean, people are talking about the Smithfield testing, and Avera is their healthcare provider, so I'm thinking that they are picking up the tab for a bulk of what's happening medically with the Smithfield population. But if somebody doesn't have health insurance and they have to pay cash out of their pocket, somebody had floated like a $6,000 price tag. That's why I'm asking.
I'm going to take my mask off because I think you can hear me better without it. The cost, I don't know how much the test costs to perform, but I do know that the state is covering the testing, the cost of the testing. So I don't think there is a cost of the testing to the individual. Now, the sampling, I can't answer that. If they're charging for a sampling, do you know, Sandy? Yeah, I'll get that information and share it tomorrow morning.
But there's some people who might have to pay out of pocket? I mean, it's not like these tests are free, right? If I'm going to my doctor, I have symptoms and I want to be tested, is that a free?
So any uninsured patients are eligible for the state testing, and so it would be free for anybody who's uninsured. So there is no cost if you don't have insurance. And insurance carriers have been, there's been a federal effort to be waiving those fees for that testing. So I'm not aware that anyone is having to incur a cost, and the amount that you described is not what I would understand for the basic test. Now, you know, if you want an antibody test or something of that nature, that would be a completely different situation than a straightforward nasal swab test that's sent to the State Department of Health to be tested. But I'm going to double check. I'm going to double check on that, and I'll get that back. I'll bring that tomorrow morning.
So whether you're insured or not, it'd be nice to know what, I have no idea what it costs, because somebody's paying for it, whether the federal government's reimbursing us or the health insurance pays for it. Somebody is paying for the test. So be good to know, is it $30 to do it? Is it $500? Oh, so thank you for that. And then I have some questions. Is Jeff Eckloff still on the phone?
Yes, I am,
Okay,
Counselor.
so but I wanted to come back to the isolation spot. Counselor Neisert asked about that there could be a possibility for just an average, somebody who's not a vulnerable population to have that available. That's great. Let me move over to Jeff. Jeff, thank you for your wonderful information on the SOAR program that you've been doing throughout our community. Just for the record, so that everyone here hears this, explain to the population how funeral homes are going to be handled.
So, and thank you for forwarding that. I've had a conversation with a couple of them, and in the interpretation of the ordinance as it was forwarded last week, if it's not changed tomorrow, they're not in the category of the enclosed businesses. So the ordinance encourages them to social distance and then follow all the federal, state, and local guidelines, CDC, for cleaning and that type of thing. So the conversations that I've had with the funeral homes are, you could, once this ordinance passes, you could open back up and you could have funerals as long as you figure out how to social distance, and you'd want to put in the cleaning and the different things. We've had conversations about food service and what they would do. And really, at the end of the day, it's up to them to decide what that. So, for example, I think one of the larger funeral homes has a occupancy or capacity of 400 people. Obviously, they wouldn't put 400 people in there. They'd have to figure out, how do I distance? Do I distance groups? Do I distance immediate family? They'd have to probably have extra staff with ushers to kind of manage that. If they did visitations, you'd obviously would need to space people out, and if depending on the weather, would they be outside? How would that look? So there's a lot of logistics they have to go through, but they could be open. And what I've encouraged them to do is to really think about long term. What do they want to have as an answer when people start calling? Because they're going to have, just like there's in the city, there's going to be customers, families that they want to throw it wide open because Dad had lots of friends and we want everybody to be here. There'll be families who are very cautious and they may only want immediate family. And so they'll have to try to figure out how to accommodate that. But essentially they would be allowed to open as long as they social distance.
Well, and they were, for the record, the funeral homes and churches were never included in the lingering ordinance. There was.
That's correct.
So I think there's a misconception in the public that there were these mandates against certain institutions or businesses that really didn't exist. So we're not setting those.
I think a lot of people are trying to follow the 10 and under. I think that's where and I don't know. There's been so many changes now, Councilor Seeley, I can't remember where that all started, but you're right. They weren't under any ordinance, but people did tend to conform to the 10 and under.
And I have to tell you that I've gotten several emails, and I'm sure my colleagues have as well, people requesting a sunset on this ordinance that we're talking about tomorrow. I'm bringing this up now because you opened the door earlier. But I had mentioned when this was presented last week that it would be nice to have an end date on this so we could reconsider, as we've been doing with the lingering ordinance. That I got great pushback by people presenting that. But there's still concern in the public that we have something in place that would reevaluate this. And as I said last week, and I'm going to say it again tomorrow, we've got to be ready with our finger on the trigger in case we have these intense spikes happening. I'm hearing from people that they think that this is just everything's lifted off now, and they're just having at it. And it's hard to explain that you can have 6 people sitting at a table that are not related to each other, but you can't have 6 people sitting together at a funeral. Or how are these? Or I could be with 6 different people and 6 different nights, and so we're really allowing people to get close. We're not mandating that employees wear masks. And I've got to tell you, I went to a grocery store last week, a very big chain in our community, and they hadn't even sanitized the carts, and there was no hand sanitizer in sight. I had to track down the manager and say, gee, can I wash my hands or wipe this down? So I think the practices are across the board, Jeff. And this morning, the mayor said on the Argus Leader little live streamed video that they really aren't going at this with the idea of enforcement, that you want to help versus put the hammer down. Could you address that, please?
If you look in the ordinance, the for lack of a better term, the hard boundaries are around those with the enclosed public gatherings, so the bars and the restaurants, and so there are some teeth around that, and of course there's more of an enforcement component to that. With the other businesses, the language is such that there's not a shall in there, and so the enforcement is there's a lot of suggestions, and we certainly work with them, we encourage them, but there's not that firm enforcement that there probably is with the other class of businesses. The other thing is we are limited what we can make people do. There's limits on resources with masks and some of the PPE that's out there. That's been a issue, one of our country's issues, as you know. And so we would like to see more people use masks as well, but we also understand that there's a shortage of them too.
Any other questions, councilors? Anybody on the phones?
Mr. Chair.
Go ahead, Councilor Kiley. Then we'll go to Councilor Starr.
Thank you. Yeah, I just wanted to follow up a little bit with Jeff's response to Councilor Staley's question about enforcement. I do like the idea of having an enforcement clause in there, provided that, we're not overzealous about enforcing it. And I'm assuming that the intention is that we'll work with a business, and then we may even go back in and work with a business a second or a third time. But if it becomes apparent that business is just simply, after multiple visits, that business is just simply ignoring the ordinance and the assistance that's been provided to them, at that point in time, then we could look at enacting a fine. I would much prefer to do it that way, so that we're not initiating something that's harsh across the board, because the vast majority, I believe, the majority of people are going to abide by the ordinance, and they're interested in doing the best job that we can. So I hate to penalize everybody, but I also believe it is something, it's important that we have something in there for maybe that 1 to 5% that just simply are going to choose to ignore it. Can you address that further, Mr. Eckhoff?
Yes, thank you, Councilor Kiley. So the Section 4 of your ordinance talks about all other businesses other than the ones that are the enclosed retail are expected to maintain social distancing between parties, and then you borrow the definition of parties from above, which are 6 or more people, or 6 or fewer, people, and then implement and continue to implement procedures, ensure compliance, et cetera, with federal, state, and local. So there would be enforcement on that. If you think Councilor stated kind of like some of our code enforcement things, we have to catch them in the act to do that. And so enforcement can be difficult. Obviously, I think Councilor Kiley is right. If you have somebody who is blatantly and repeatedly offending and ignoring it, then it's a lot easier to enforce. If you have somebody that occasionally happens, or somebody moves a table or something, and it's going to be hard to enforce. And plus, I think the spirit of it is there'll be slips. People are human beings, and they will probably sometimes wander where they shouldn't be, and staff won't always catch them immediately, but hopefully we'll then guide them back. And we're trying to be helpful in that vein. But like a lot of things, it does kind of comparison to the code enforcement world. You end up really trying to deal with those that are the worst offenders, if you will, and controlling what you can with that.
Yeah, I would.
Yes, Mr. Eckhoff. Well said, Jeff. Because you brought up another point there. It's possible that things may happen that are out of control of the business owner because they can't be every place at all times. So I'm glad that you pointed that out as well. Thank you.
Director Franken, did you have something?
Sure. I just want to add that I completely, I was going to point out Section 4 as well until Director Eckhoff did that, which was completely correct. That would be an area that we could enforce, making sure that all businesses are following CDC guidance and that they're using social distancing practices. In addition, it's just really important for our community to remember that we are all in this together, because if we start seeing a spike in our cases, you all are going to have to, probably see us again with some additional ordinance that we may have to bring forward if we see some really unintended consequences of loosening this up a little bit. And I'll talk about that in the morning, about getting into that middle area between where we think our modeling is now taking us and where it's going to be too much for our health systems to handle, and we will all pay the price for that. And so we all have a responsibility, business owners, patrons, everyone, to follow what has been recommended by the CDC during this time period, which is, at this point, it's, we're talking a long haul here for a while, so.
Thank you. Councilor Starr?
Thank you, Mr. Chair. Director Franken, maybe I can start here and see where we end up. Let's do the USF stuff first. If you want to, Sandy wants to do that. I guess and I know Chief Burns is here too. I guess who specifically would be staying at USF versus a hotel, and then deeper into basically what are we asking our city employees to do, our first responders? When is it prudent for them to not go home, and just kind of an overview of talking a little bit about that, what we're telling our employees.
Sure. I'll say, yep, Jeff Helm is here with Sioux Falls Fire Rescue, so I'll have him speak to the USF piece. But there's distinct differences between these two types of, resources in our community. We know that there are people that can't successfully isolate and quarantine that have either been known to be positive or they have been in close contact with someone who has COVID and have been told to quarantine. If they cannot do that effectively at the risk of infecting others, then they need to be advised to do so in another location. And so that's what we're setting up as our isolation sites, if you will. And then the option for USF, that through USF is something Jeff Helm can talk about, and that's a little bit different, so I'll let him speak to that.
Thank you. Jeff Helm with Sioux Falls Fire. First off, I'd like to thank USF for partnering with our community for this alternative housing. It was very generous of them. First off, they're not charging us any rent, so it is a partnership. Just costs for utilities and for cleanup, which would be understandable after the event. Like Director had spoke about, it's not for people who have symptoms. It's for an alternative work site or a residential site for critical personnel, so that way they feel comfortable continuing to go to work and not worrying with their circumstances. Maybe their family is in a different circumstance and they just don't want to have any risk of bringing something home with them, if that makes sense. So it's an alternative place for them in their situation as a critical personnel, so that way they have an option to feel comfortable to continue to do in their critical role for the community. So they have an alternative place to stay during this pandemic. If that helped answer some questions, I can sure follow up with any.
It does. Let me follow just a little bit if I can, Mr. Chair. I guess what I'm looking for a little bit is what would we say to one of our street officers, or when would this be appropriate? What are we saying to those people? I mean, I get they don't want to go home, but what's the guidance they're actually getting from their supervisors and through the thing? I mean, is it really encouraged? Is it, you know, I mean,
it's going to be an individual basis from their supervisor. We've shared it as a resource. It's kind of an individual because we know everybody's going to come at it at a different place. Some people are comfortable, they may be single. It's easy for them to stay home and not feel like there might be a risk to bring something home because they're by themselves. Or they might have a family member that has young children, and those people might feel a need that this would be an alternative for them. So to kind of answer your question, that's kind of the guidance. It's a personal choice. It's freely given to them to use and encouraged for them in their situation. If they feel a need to it, we want them to use it, if that makes sense. And I'm sure Chief Burns can speak to that for his team as well, if he would like to.
and just to go down that line a little bit, so then if someone did test positive, well, let's go back. If someone was exposed and they need to quarantine, would this still continue to be a place for them to, then they would need to move to a hotel or some other, so once someone is positive or in that process.
This is for people who are not symptomatic, that they can continue or are cleared to go to work. So there'll be other alternatives for them in those situations. So we have guidance for that in this agreement with those that choose to use this location as well.
Will we include other people outside of city employee, like hospital, a nurse or a tech or laundry worker or any of the allied health professionals?
Critical personnel is the way it's worded, so we're open to that. And in fact, we're working with Avera and their personnel. If they choose to use it, they have access to it as well. So it's critical personnel, not just first responders necessarily. It could be critical personnel within other departments within the city that could see this use as well. So it's not just first responders, it's critical personnel. So we tried to word it that way, and USF is very generous in partnering with us on that.
So that, and this will get deeper, and I'm sure this, I don't mean to do this to you, but so then the contract for food and security is separate from USF? The food is for people who are in hotels? Okay, so we're not providing food at USF? It's too bad. I mean, it's kind of, once you're there, I mean, that's the hardest thing when you're working longer shifts and overtime and things. So I mean, so I'm not heading in the direction that we shouldn't feed them, but if we're asking people, Councilor Erickson's line of questionings too, that if food's provided, you don't have to go out looking for food and doing some of that.
We figured this is a little different situation related to them just being comfortable not housing at home. They're not symptomatic. They're able to do those type of things. So I get your point on that, but it was kind of a different angle than an isolation center, if that makes sense.
And then I saw the nods that the security then is actually for the other facilities on top of what we wouldn't do with our normal policing. So that takes me through that line. I didn't know, as long as Chief's here, if anybody else had questions, I'll back up with my rest. Go ahead.
Counselor Sell?
Thank you. I just want to touch on this a little bit. This is absolutely outstanding what you're doing, because I can remember 35 years ago when I was a young fireman, you get a call in the morning, baby not breathing, show up, do CPR, baby goes away in the ambulance, shift change, we go home, 2 hours later I get the phone call from the captain, meningitis. Did not know whether I'd already passed that to my children or not. So in the situation of what you're doing right now, it's absolutely outstanding what you're doing for our men and women in EMS and also for the community that we're not passing that on. So kudos to what you guys are doing.
Any other questions from you?
I do have other questions that go in a different direction. So I'm not sure if, Director, you're the one that can help me. I'm trying to understand the testing that's going on at Washington High School and what's happening with Smithfield employees and how that actually works. Prior to the plant opening, are we requiring all the employees, or not requiring, that's the wrong terminology. I'll make sure that I back up here a little bit, so I apologize for that. Is it mandatory to be tested before they report back to work? Better yet, do we have a copy of the plan from the CDC and then Smithfield of what they intend to do to meet the recommendations that the CDC made when they were in town to do that, or USDA or OSHA?
So the testing is voluntary. And Smithfield has been an incredible partner in getting their employees and families and close contacts to that location. I don't have an answer. Yeah.
So we do not have a copy of the plan that has been provided, if I'm remembering correctly, to the CDC, to those federal officials that have been asking for that plan and been part of that from a federal level in assuring that Smithfield is been cleared to open.
So if I understand it correctly, the city's health department, the state's health department have been basically asked to stand down when it concerns Smithfield because all of the regulation and guidance from the president's executive order says that they are only responsible to the CDC, the USDA, and OSHA.
I don't know if I can answer that the word only, but at this time, they have stepped in, they have provided the guidance, they have been working with Smithfield to ensure that they can effectively reopen their plant for operation. And that's all been done at the federal level at this time. I think, this is process I think they're using to really advise on other plants across the country. The guidance that the CDC wrote to and what they wrote to Smithfield actually came out very similarly in actual guidance from the CDC just days later. So I think a lot of this is work they're doing to also inform them across the country.
And I'm not sure you can answer this, but what is Smithfield requiring for employees before they re-enter the plant? Or what is the process? Is it just taking their temperature, or is it showing that they've been tested, or is there any of that before they even walk in the door? Because that does affect our community.
I would really hesitate to answer definitively what all they're being required to do, because after that guidance came out from the CDC, then OSHA came in and got involved, and was involved, and the USDA, so I really wouldn't want to speculate exactly point by point, but I would say that, if anybody is in a position to be advising and telling Smithfield how they should be reopening, I sure hope it would be the CDC, OSHA, USDA, et cetera.
Okay. Who do we contact at the USDA or CDC or OSHA, or how are we, do they communicate with our emergency operations center, or how are we communicating with them? Or are we now just worry about the rest of the city and that's separate? Because that's what the reading I got from the executive order is that, hey, we have no jurisdiction's probably the right word that I'm looking for.
You know, I think when you think about our role as the Sioux Falls Health Department and then our relationship with the State Health Department, if I had any concerns that were being brought to my attention, that would be my first phone call, would be to the Secretary of Health, and to say, you know, we've got these concerns coming forward. Can we, you know, work together on how that needs to be addressed through those agencies that are providing that oversight?
Okay. And a little bit to the side, but the same thing. How are we paying for all this? Whether it's the USF, some of the things that we're doing is helping with the collections. Obviously, I'm sure that's just staffing and equipment that we have available, but is it federal grant money? Is some of it coming from the state? Or how are we kind of on our own of, you know, whether it's did we sign a contract with the county today to provide some food or to pay for some food there? Is that? It's a multifaceted, I'm sure.
Well, and I should probably let Regan speak to this, but FEMA, we're expecting you want to come up and talk about from the payment mechanisms because you've really been overseeing that.
Regan Smith, Emergency Manager, City of Sioux Falls. Yes, from day one when we opened the Emergency Operations Center, we set up a cost code. So whether it's employee time, supplies, contracts, any of that is tracked to this incident. We do this every time we have an incident. So that's being done. There are multiple declarations that have been made. We've been working with South Dakota Emergency Operations Center, Office of Emergency Management on getting approval for some of these sites before it runs through FEMA, that type of thing. So we're tracking those costs after it's done. Just like on any disaster, whether it's a flood or tornado, we'll go through that. We're also working through the planning department and the housing division. There are different HUD programs that are working with those vulnerable populations. And again, we're tracking that, exploring those, making sure that we can definitely receive as much reimbursement as possible. And then again, of course, partnering, we're right hand in hand with Minnehaha County. So if there is a cost share, we're definitely working with them.
And please don't misunderstand. I'm not pinching pennies and we're going to do what it takes to take care of our residents and our citizens. That's definitely not anywhere I'm headed other than just to kind of have a feel for where we're going to have to pull money and move things around to make things work. And we take care of people in a disaster first, and then we figure out how to take care of it. And I think that's again why we're in such a strong
Councilor
position
Starr?
as a city. Yes. It's like God.
Councilor Starr, this is Jeff Eckhoff. Just to expand on what Regan is saying, that there are federal CDBG monies available for COVID for vulnerable populations. And the state gets an allocation and the city will get an allocation. The vulnerable populations team wrote a grant to the state and they received $300 and some thousand of the state's allocation, and then we're waiting to see what we get from for the city's portion of that can be used, and that'll be used to pay for the food, the security, the staffing, the hotel to house that population. So that, and we're tracking that. Some of it will be tracked through FEMA, some will be tracked through HUD, but there are a number of federal funds to help cover those costs for the vulnerable populations, the homeless folks that we are housing at this time.
Thank you, Director. So you think we'll see community development block grant money directly to the city as well as what we're getting from the state? Is that the way you're kind of explaining it?
Yes, because we get our own allocation because as Sioux Falls, and so there'll be additional money coming. We have to put a plan together, and I know the team is working on that before we know for sure what our allocation will be. And so some of it, of course, is how long this goes and how many folks but that is where the funds are being directed towards for the homeless folks that are tested and need to be quarantined and isolated in the hotel.
Thank you. I'm done. Thank you.
Any other councilors have questions?
I've got one more.
Okay, let me just check one more time quick on the phone. Anybody else on the phone have a question? Okay, Councilor Staley.
I think I heard Sandy talking about the One Sioux Falls rental did you say that they had 50 applicants today? Or did the mayor say that this morning? They're kind of running together.
So in the report that's, so Janet Kiddums provides us an update daily as part of our Emergency Operations Center briefing, and she says that they are continuing to see about 50 new applicants a day.
Okay, so you did say that. What I'm interested in, and again, I've been contacted, as I'm sure the rest of us have been, by that entity that represents tenants. And they're concerned about evictions. And so those people who aren't being able to be helped with the money that we allocated for that, I would like to know if there's some way that we can track the added homelessness that is a result of that. Maybe it's, I mean, I think they were concerned as May was starting, they weren't going to have the money. And do we know how many people have been evicted? And I know this isn't like a health department thing, but you did bring it up. But I think it's going to make me feel better if we find out that isn't happening. So the shelters, I guess, would be the big indicators as to if they've had a lot of, and I see we got the rent, we got the landlords here today. But it may be maybe they're going to be able to tell us a little something.
I guess from,
Well, actually, she's shaking her head. Let's have her come on up. Denise, did you hear my question? Okay, good. Sorry, Jill.
Hello. This is a unique situation, isn't it? I do have my mask, but I will.
If you can introduce yourself, please.
Oh, sorry. Denise Hanslick, Executive Director for South Dakota Multi-Housing Association. Thank you for the question. I did have a prepared statement, so I'll go ahead and make that at this point. At recent city council meetings, there has been public input about the possibility that property owners are evicting residents during this COVID-19 crisis. Some may be, but do we know why? It may be for past due rent from before the COVID-19 crisis began. It may be for criminal activity. It may also be for another lease violation that has put the other tenants and residents at risk. So it could be a life safety type violation. In April, we did survey our members in the Sioux Falls area that were receiving the One Sioux Falls Fund, because that's what you were specifically asking about. Of the 77 responses, and bear in mind that out of this, it was only 77 responses, but some of them may be responding for multiple properties, okay? 59 had received a portion of the rent from the One Sioux Falls Fund. Of those, we asked them, what are they doing with the remaining 30% of their rent? 30 reported residents had already paid that portion. 8 reported that a resident has not paid or responded to the owner or manager. 31 report payment plans have already been set up. 3 report the owners waived the additional 30%. 0 had started evictions for April's rent. So, you know, that was our April response. We do plan to survey our members again later this month, and we'll continue to watch that. But to make a blanket statement that we should end all evictions is irresponsible. To provide you some, I did give you the accurate information from April. We do not encourage the city or anyone to enforce a blanket eviction moratorium, because one size does not fit all. Everyone, the residents and the property owners and managers, their situations are different. If a resident can pay rent, we ask that they do. Same thing, we are encouraging our owners and managers that they need to work with their residents. It's about communication. Communication between the residents and the property managers and owners. Some owners may be able to forgive rent, and we did see some of them do that in April. However, most are not going to be able to afford to forgive rent. They have financial obligations for that property: lawn care, utilities, mortgage, real estate taxes, and payroll. And the residents need that property to be functioning and operational. I urge you not to listen to the fear tactics of some when the vast majority of property owners in the Sioux Falls area are professional business people and are working with their residents. Thank you.
Thank you.
Any other questions?
No, I was, Jill, did you want to add to that then, as far as like the effect of, I understand what Denise is saying, but the fact of the matter is that if a person isn't falling into those classifications, then they would be evicted, and that, so are we tracking how that plays out?
That level of effort would be beyond our EOC functions at this time. I'd have to bring that back to see how that might be accomplished. It's not in my daily understanding, other than having been on the Homeless Advisory Board, which I know how difficult it is to track homelessness in our community in the first place. And so this would be a new level of difficulty, to do so during this time period. But there's certainly, I can take that back to the EOC and see if there's anyone that's working on that perhaps already. So I can let you know about that.
Well, and it sounds like from what Denise said, that by the time someone is going to be evicted, this has gotten to be a very chronic problem. And at the end of the day, I think we just, especially now, always, but right now, I don't think any of us want to see somebody, ending up on the street. And especially, it sounds like, let's say that someone in that apartment situation had COVID and needed a place to isolate, they could almost be a candidate for this isolation center.
And they would be. So yes, but I do remember we specifically talked about this in one of our press briefings early on when One Sioux Falls Fund was being developed, that it didn't mean all evictions were not going, that were going to be stopped necessarily, because there are some valid reasons why somebody can no longer be in the property they are, and they may not have anything to do with the ability to pay or not. So those are extenuating circumstances that we will probably still see some of, that I think you talked about.
Thank you.
Yeah.
Okay, any other questions, councilors? Councilor Neitzer.
Regarding the One Sioux Falls Fund, can somebody just give a little bit of more information about the second month? Are people going to have to reapply? Are they being contacted proactively? How is that looking? Maybe in a general sense.
Janet did give an update this morning in our EOC briefing, and I'd have to go back over to my chair to get the exact quote, but she did say that they were accepting reapplications for additional help that people would need, and for those that would be eligible.
Okay, thank you.
Okay.
Not sure.
I'll just stand here for a second. Do you need me?
Okay, any other questions? I'm sorry. All right. Ma'am, I'm sorry, somebody addressed you for a question, or? If you want to speak at public comment, you certainly can. Okay, thank you. When we have public comment portion of the meeting, thank you. All right, we will move on to the next presentation. We've got Director Pritchett and Chief Burns, I believe, are here for the new government lease standards and Southwest Police report of the workstation. Welcome.
Welcome. Sean Pritchett with Finance. Can you hear me okay? So I'm here to talk about an accounting standards change as it relates to leases. Now, typically we don't come to council and talk about accounting standards change. One, it's not the most exciting topic, perhaps, but typically it doesn't rise to the occasion of necessarily informing you because it doesn't have, it has, some sort of accounting applications, but not necessarily rising to the occasion of bringing to your awareness. This one, however, does, and that's why we're bringing it forward, both in conjunction with, it's a standard we're going to have to meet going forward, but it also is timely because we're talking about the report to workstation for the Southwest Police Station, and that piece will fall in, this would be the first application of this new standard. And that has implications in terms of additional council actions that may be required in order to facilitate that, other than just agreeing to a lease agreement. So I'm here to kind of walk through that. I don't want to get too granular, but I do have to get into some details so you understand some of the actions that you're going to be taking or would be asked to be taking that are somewhat unique from anything that you've seen in the past. And to that extent, this is still very new to us, and we're kind of working our way through this process as well. The standard has been out there for about 1.5 years, but it hasn't come to execution until this year, and the guidance on it is still a little hazy, but we're learning as we go along. So first thing I want to talk about is what it really is and what it means and why this came about. Leases are not uncommon, both in the private sector and within the governmental sector. We don't do a lot of leases through the city of Sioux Falls. However, there are other entities that do, and I think what rose this potential change in GASB recommendations for accounting is the fact that many communities were engaging in a lot of leases in substitution for taking on debt. And in doing so, maybe we're underreporting their actual debt. In most respects, for anybody who's ever leased a car before or gone through that process, you'll understand that lease is financing. You're financing an asset, you're financing the depreciable portion of that asset over a certain period of time. So it is very much debt, but in many situations it wasn't termed as such. Let me raise that a little better.
Yeah, thank you.
So it hasn't been termed as much as debt, and particularly for governmental entities like ourselves. So that is kind of what has prompted this change to occur. From that respect, that's kind of where we're coming to today is how this is going to be treated for us as a city or municipality going forward. So there's going to be 3 parts to this presentation. First, I'm just going to talk in generality about the new GASB recommendation. Then Chief Burns is going to come up and he's going to talk in specifics related to the Southwest Report to Workstation, because that will be the first application. And it's a great example of how this impacts us. And then thirdly, I'm going to talk a little bit about further actions that may be requested from you in the weeks ahead based on some of these changes. But from this point going forward, in many respects, most leases would be considered debt as regards to the city. So it becomes potentially part of our debt covenants, and it becomes part of our debt limits. As I said, we don't do a lot of leasing. Even the lease that we would be proposing to do for the Southwest Report to Workstation, we're not talking about significant dollars relative to our overall debt or our debt capacity. And so from that respect, that is not really a significant issue for us, but it's one that we just have to recognize we have going forward. Just a little bit of background, this was introduced in 2017, but the guidance has been fluid over that period of time. Our accounting staff has sat in many webinars, sessions in regard to this, and we have consulted with our external auditors to make sure that we're accurately reporting this. But the first year this is really effective for us is in 2020, so any prior leases really are kind of sort of grandfathered in. I'm saying that simply, but for the most part, they're either de minimis in terms of their total amounts, or they're just grandfathered in so they don't impact us. So it is primarily for new leases as we go forward, and it affects 2 sides. One, where we are the leasee, where we're leasing property, or we are the lessor. If we decide that we are going to lease out some of our property, this has implications for us as well. Most of you understand what probably a lease is, but just as a kind of reminder, it's a contract that conveys control of a right to use an asset for a period of time, an exchange-like transaction. And typically this is going to be for things like buildings, equipment, and machinery. In the example of the Report to Workstation, it is for a building. There are some minor exclusions from this rule. The main one that we would introduce is if it's less than 12 months, they're excluded from this rule going forward. But if it has any extension beyond 12 months, it is included in this rule. So a 9-month lease with a 9-month extension would be part of the GASB 87 requirements. In terms of how we prepared as a city, as I said, we've been working in some regard to this since 2017. We have worked with our auditor on appropriate thresholds for our existing leases and assessing how we or whether we lease going forward and whether we change some of our philosophies or decisions as a result of some of these new standards. And we have worked with our external auditor as well as the South Dakota Department of Legislative Audit as we've kind of worked through these changes. How do we account for this? So I'm going to get a little bit granular, and I apologize for that on the accounting side, but it's important that you understand this because there are appropriation and budgeting implications in regard to this. from a governmental-wide financial statement. So we have various financial statements, and Kurt, I know you're smirking here because this is more granular than you want to be, but a government-wide financial statement is like a private entity financial statement. And from that respect, so we have various types of financial statements that we produce as part of our consolidated annual financial report and for you as the council. But this one is like the private market. When we enter into a lease, we will have to record an asset and a liability, unlike what we have done in the past. So we will record that lease as an asset, and we will record it as a liability. The amount that we will record will be based on a present value estimate of the future payments of that lease. But a key piece of this is if that lease has an option to purchase that asset, we also have to record the present value of that asset if we expect reasonably that we will move forward with that option to purchase. And that's a really very key item that I want to stress to you now, because that is part of our Southwest Report to Workstation agreement. And so in doing so, we are essentially booking a physical asset we do not own on our balance sheet, and we are recording a similar liability as part of that as well. The other piece of that is we will depreciate that asset as if we own it. And so we will record depreciation at the end of the year as if we own that. Again, if it's an option to purchase, and if we decide that it's reasonable to assume, we will exercise that option to purchase at the end of that lease. If there is no option to purchase, we still depreciate it, but we'll depreciate it based on the life of the lease. Then we will record lease payments, and we will split them into interest and principal payments. Now, if you know a lease payment, it's just a lease payment, right? It doesn't necessarily have an interest and a principal portion. So we are required to estimate what interest would be and record it as an interest expense. So you can see how interesting this new change is for us. So we'll have interest expenses, and the principal payments from those leases will go to reduce the liability that we've put on the books relative to that. This is the part that I want to pay particular attention to. So on our governmental fund financial statements, so a separate type of financial reporting, think of this more like we're doing a cash basis of accounting to us. It's a shorter term look at our inflows and outflows, matches more closely to how we budget as a city. The total expense of the lease liability is required to be recorded and budgeted. It will be recorded as a capital expense and an offsetting revenue source, which we are calling offsetting lease proceeds revenue. So this is a non-cash expense offset by a non-cash revenue source. However, in order to kind of coalesce that with our budget, it will require some action from the council in order to essentially budget for, and one might term appropriate for, those funds. It's unique because we typically do not appropriate for non-cash expenses and non-cash revenues. But that is what the new guidelines and requirements for GASB are putting on us, because when they passed GASB, they didn't think about the budget implications it would have for municipalities like ours. So it does require the appropriation. It is non-cash, and this happens one time at the beginning of the lease. And so when we get to the Southwest Report to Workstation, we'll talk about what that amount would be and how that would be transacted. We also have to appropriate for the monthly payments for that lease. So it's almost like we're duplicating an appropriation, but this is the cash side of it. When we talk about the Report to Workstation, we have already appropriated for that as part of our budget from last year. So you won't see an additional request for that coming forward. Those simply have already been included in the budget that you approved previously. And if we're the lessor, we do the complete opposite. We book an asset for a lease receivable for the entirety of that lease, and then we book a contra liability, just a liability called deferred inflows for that. And then we record those lease payments coming in for whomever we are leasing to as a revenue source. So that's a lot of information. At this time, what I'm going to do is Chief Burns is going to come up and he's going to talk about the Southwest Report to Workstation, because that agreement will be coming forward to you potentially in the next several weeks. So it's good for you to have a good understanding of what that's going to entail. Then we're going to talk a little bit about what the financial transactions of that lease will look like.
Thank you. Welcome, Chief.
Hello, Police Chief Matt Burns. So that was the easy part. No, just kidding. So I just want to take a few minutes to discuss the progress of our Southwest Report to Work location and refresh your recollection as to the process that got us to this point. So in 2017, we began looking intently at the future growth needs of our department and analyzing the space and facility requirements to accommodate the growth that we were experiencing at that time and the growth that we expected to continue and in fact has. So the Law Enforcement Center was constructed in 2003. It's a great building and serves us well, but the reality is that the space afforded by that building is running up against limitations as far as workspace, parking space, and certainly locker room space. That's due to our growth, but also the growth of the Minnehaha County Sheriff's Office, which we share the building. So the opportunities are limited for the Law Enforcement Center expansion because of our physical footprint is limited by the space around us and that the building was not designed to be extended upwards. Accordingly, we asked for and received your approval for a remote report-to-work study that was completed in 2018. That study identified the need for a Southwest Report work location and an evidence drop-off facility in the southwest part of the city. This location will support on-site an estimated 30 sworn police officers and up to 12 or a dozen marked patrol cars, as well as the secure evidence drop-off location, and that will also be housed inside the structure. Again, this reallocation of resources frees up space at our law enforcement center in terms of personnel and parking for personal and department vehicles. The decision was made to seek a space to lease for a facility in lieu of buying land and constructing new at this time. The prime reason for that is to reduce the upfront capital needs, and it certainly gives us options in terms of operational flexibility regarding future needs. Again, some of the advantages of having this remote location is in not having all our patrol staff change shifts from the law enforcement center. It will improve response times to the southwest part of the city. And by having secure evidence drop-off contained within will reduce the time needed to take those items from outward parts of the city, specifically southwest, to downtown, and therefore increase officer availability time. The proposal was brought before you as part of our 2020 budget presentation and received your approval for this budget year. So after researching various sites, we found that an excellent location and building that will fit our needs is at the same time is at 4000 West 57th Street, which has been under lease to Patient Care EMS, formerly Paramedics Plus, for some time now, but they will be vacating that building and moving to a new location. The property and building you see here was constructed in 1999 and last renovated in 2015. It is just over 8,100 square feet, of which just under 2,000 is office space and a little over 6,100 square feet is garage space, which affords us a generous amount of parking inside for the patrol cars as well as our evidence drop-off. Here you can see some of the interior features, including a garage space with 3 overhead doors for vehicle access. Outside, the available space provides ample parking for employees with entry and exit on the east end of the property. The office area features a conference room, private office area, open office area space to conduct shift lineups, workstation area for supervisor cubicles, and a finished storage room with shower and 2 restrooms. The agreement with the building owner is for a 5.5-year lease, which is effective on July 1st of this year. The monthly payments are $5,069, and they are due at the beginning of each month, with the first payment being due July 1st. Built into the agreement is an option for the city to purchase the building for $1.5 million at the end of year 5, but we also have an extension option for another 5 years, and that purchase amount is supported by an appraisal. So at the end, we could extend potentially to December 31st of 2030 if that's the desired option of the city.
Thank you.
So as far as what how we handle this procedurally, so we're working through those options and with hopes to bring those forward to you on May 12th or potentially on May 19th. But it will require most likely an ordinance to come in front of you. So in many respects, we treat this like debt now moving forward as opposed to an operating lease. With that result, once we take occupancy, the city will book this as an asset and as a liability. Because we reasonably assume that we would potentially move forward with an option to purchase, we will book the full amount of that option to purchase as both a asset and liability, as well as the lease payments. That is what GASB 87 requires to us. But I do want to stress to you that is an option to purchase, and that decision to execute that doesn't get made till many years from now, until we get closer to that 5th year. If we choose not to, there's nothing about booking the asset from an accounting perspective that requires us to move forward with that option to purchase. Ultimately, we decide not to at that time with that council. We just reverse the entry at that point, and there's no material impact other than just reversing some depreciation off the books and reversing the asset as well. But because we reasonably assume that that's potentially available, we do have to book that full amount, and that full amount is $1.7 million. We have to extrapolate an interest payment that we have to separate that $5,069 that Chief Burns referred to, that we have to estimate that. So the estimate we are using, working with our external auditors, is a 2% interest payment. That's essentially what we believe we would be paying if we were borrowing on a 5-year term as a municipality. So that's the imputed interest rate that we are utilizing. So the present value of the lease payments over the first 5.5-year period is $325,000. The present value of a $1.5 million purchase 5 years from now is $1.375 million. So that is where we come up with the $1.7 million. And again, that is something that we would have to move forward and ask for a non-cash appropriation to make that reconcile within our budget. It's not unlike, we would have to also add it as a project within the capital program. It is not unlike when we come back to you and supplement our budget for grant funds we might receive. So when the police has received JAG funds in the past, we've come forward with capital requests to amend those. So we we have the assertion that we have additional revenues coming in, and we offset that with the additional expense. In this case, we have additional revenues that happen to be non-cash that will offset a non-cash expense. So I want to be very clear on that, because it's very different than anything that we've brought forward with in the past. So as I noted, we would have to come forward with a budget supplement for the $1.7 million non-cash expense and revenue sources. The future leases would be classified as debt payments with interest and principal components, and the asset will be classified on our books and depreciated over a 40-year period. As I said, we're still working through the mechanics of some of this, so we're hoping to bring through this back to you on May 12th, but we are working with legal, and this is all a little bit new, so we don't have a great template to work from. So we will be coming forward in some semblance with an ordinance, which will require 2 readings that will deal with the appropriation and the acceptance of the lease agreement. They may be separate items, or they may be combined into one singularly. So we're working through those details and hope that we'll have it available for you on May 12th or sometime thereafter. So if you have any questions in regard to the financial side, I'd be happy to answer those now. Chief Burns, I'm sure, will be happy to answer any questions you have in regard to the report to workstation.
Councilor Erickson?
Thank you. Sean, I know my question is before your time, before you came on to the finance department, so please don't take this in a snarky way, I'll say. But my question to, just in general, is when the city center was being built, it was sold to the city council that, hey, do this, and we're going to consolidate all of our leases because leasing is dumb. And then now we're talking about leasing because it's the right thing to do. And it's a roller coaster of, hey, before it was a bad decision, now it's a good decision. So walk me through why
leasing now?
The better decision. And again, I realize you weren't here then. And the building's beautiful. It's great. It's serving a purpose. It's just that component was really that got it to the finish line of saying, we got to get rid of all these leases because it's just silly to have all these leases. And now we're talking about doing it again.
It's a good question, and you know, if you look at the long-term perspective, if we anticipate occupying a building or staying in a building long-term, then owning the building is naturally the better way to go from a long-term and financial perspective. And honestly, if we could buy this building now, optimally, that would probably be the most financially prudent thing to do going forward. It would save the city money, but there's a couple of reasons to look at this. Firstly, we went into this looking at a lease because, one, we weren't aware that this building would be for sale, and it's not. They've agreed to an option to purchase as part of our lease agreement. We kind of added that later in the negotiation process, so we talked about leasing the building, but we asked for, if there's an opportunity to buy it, would we have that opportunity? We also had a lot of discussions about whether we would be jointly co-locating with Lincoln County, or, you know, other things that would be occurring. And, you know, those conversations take a lot of time, and our need is now for moving forward with this project. This building is unique for us. I mean, being able to have that kind of internal garage capacity while also having an office space that it's almost perfectly situated for this report to workstation makes it a unique location. So there isn't really other locations that are perfect, that are in this area of town that meet the police needs. And so leasing was our option at this point. It still provides us some flexibility, but buying certainly would be the more optimal choice if that were available to us.
And thank you for that, because I know, I mean, this is a new concept where we're doing the report to work, and so maybe it's not 100% the right location, or maybe it is, and so to have that pilot program really too is important to have in case we go, oh, this just really isn't the right location, we need to move further east, or whatever it might be. There might be a different building that comes up, and so to pilot in that way too, I guess makes sense. I just was kind of curious as how that's worked out. And then I have a question for Chief Burns too, if I can. I'm sure the question has come up a little bit, and just to be proactive in the questioning, talk to me a little bit about the difference between report to work and precinct, because I know they're very, very different. But I think that those words, unfortunately, have been intermingled, and so I just want you to tell everyone what really is the difference in report to work. And I've had this conversation with you in the past, so just for the benefit of the public, if you could, please.
Certainly. So a precinct system, if you look at a model like the Minneapolis PD, they use precincts and they have their own separate command structure. They have their own separate statistical gathering units. They dispatch not only their patrol function out of there, but they have detectives. And so it's like a mini police department assigned to an area of the city. And that's not what we have. And it's frankly not what we needed. We just needed a separate location that we could dispatch officers out of to take pressure off our current law enforcement center footprint, to have an evidence drop-off location. But we're not going to be tracking statistics differently out of this site. It's not going to have a separate command structure. It's just merely a separate report-to-work location. And so it's not nearly as complex, if you will, as a true precinct in the precinct model.
Wonderful. Thank you for answering that. I just want to make sure that there wasn't any confusion with that as well. And I think that this is a very unique, great concept for our city as it continues to just really sprawl and spread. It's a great opportunity for the police department to be able to have an option like this. So thank you for that.
Councilor Staley?
Well, this is deja vu, because Councilor Erickson brought up exactly what I was going to reference, that it was 4 years ago when we were having this discussion right after we got elected about this administration building. And I remember our city attorney's office was being leased. And I think and Councilor Neitzer, maybe you know, but I think we were paying about $70,000 a year on that lease. Does that sound?
I think by the end it was like 115 or something.
A year? Because I thought it was 70.
Somewhere in the 100,000 range.
So, and Chief Burns, this isn't, this is more for Sean here. So, but, you know, the thing we're doing right now, where we're repurposing a building to meet our needs, and that is exactly what at least 5 of us on the council at that time thought was the appropriate course of action. We were looking at the 300 building. Took a tour of that. I mean, the whole thing was, I think back on that, it was huge. And one thing I would like to get from you, Sean, is this is a personnel matter, but I'd like to know how many employees are actually in that building. We're paying, what, $24 million that is not leased, that is a debt, that is real debt for our people. And I believe almost $1 million in debt payment a year. So what I'd like to know is, as we're talking about leases, and you brought this up, I hadn't thought about it actually since we had the administration building debate, but what I think would be beneficial for the people is to get a list of all the leases that we're involved with. If you could write that down, and so the leases the things we're leasing, which I thought we had kind of gotten out of the leasing business, and then the things that we're leasing out. our assets. And then, how much are we going to be paying a year when it's all said and done for that 5.5-year lease? What are the annual payments going to be?
Approximately 60,000, so it's 5,069 per month. We are also required to pay utilities, which we would pay whether we own or lease the building. And we do have property tax payments as well because it's a privately owned building and we're responsible.
Who does own the building?
I don't have that recollection off the top of my head.
I think that would be good to know. And also, who negotiated this rental agreement with them?
We worked both with purchasing and our real estate area division in working with developing this lease agreement.
Yeah, so, yeah, knowing who we're leasing this from, because at the end of the day, it's kind of a rent to own, but it kind of isn't.
And that information will be on the agreement because you'll have the agreement in front of you when that moves forward, so it'll have a signatory on there, and the agreement will note who it's being leased from as part of that lease agreement. If I can refer back to some of your earlier questions in terms of what our leases, we don't have a lot of building leases anymore that I have good recollection on. We do have one building lease I'm aware of, a small amount of space for vector control. So for our mosquito control, we do lease a small amount of space in regard to that. And then I think that's the primary one. Most of our leases tend to be equipment, so rotograders and things of that nature. We do have equipment leases, but we don't maintain a lot of real estate leases.
So that's all coming into this debt ratio thing?
It won't be at this time, from my understanding, because it's kind of grandfathering in, so it will be new leases moving forward. I'll have to check to see. I know we don't have to go back and make appropriations because they're not new leases. Going forward after that, we would, if we execute those type of equipment leases.
But it's leases, it's any kind of lease? Leasing the motor graders?
Unless they're less than 12 months, would have to meet this, would be incorporated into that.
Okay, thank you.
As far as what we are leasing, a bulk of it is just some certain lands that we have, usually raw land that's being farmed or being used for other options that come before the council. Those are primarily the only leases that we have for leasing out facilities at this time.
Councilor Starr?
Yes, Director, the property tax answered my question because it's still in Minnehaha County, right, north of 57?
Yes, it's north of 57, yes.
And then how will we sign the building, and will it be open to the public? Will it be kind of conspicuous other than, I mean, it's good, it's in a commercial area that if people leaving fast, they're used to that already, you know, in that area, so there isn't a lot of residential that's close, that type of thing. So will someone know driving by that it's?
I'll defer to the chief on that question.
Sure, so our intent is, I believe, to have a small sign on there that says Sioux Falls Police Department. It's not envisioned right now to be and open to the public. It will not have like a front desk area. It's just meant for officers to go there and get their briefing, don and doff their uniforms, and have a place to get their briefings and stuff like that. Is it possible, as we continue to learn about this process and see what works best as far as process, to have an officer there at the desk? It certainly is possible. It's just not envisioned that way right now. We really need to get in there and get a good sense of actually what our workflows and processes need to be, and that'll be informed best over time.
Then sorry, I have one more for Director Pritchett. I was looking, the county has the property assessed at just about 900,000. So we think that it'll appreciate to 1.5 or in the next 5 years. Is that kind of how the thought process went?
That was based on an independent appraisal, yeah. So we engaged in an appraisal to make that determination of what they estimated the value of that property would be 5.5 years from now.
Perfect. Thank you.
Councilor Neitzer. Are there additional costs expected and budgeted for reconfiguration or remodel that we may want to do, plus any, furniture, fixtures, and equipment?
Can I speak to that?
So I think we budgeted around $50,000 to $60,000 for some slight renovations. It has to be appropriate for and secure for police operations. You're talking about maybe adding some locker room space in there, which I don't think there is a formal locker room space in there now. It wouldn't be anything, extravagant certainly, but we do have some money set aside, and in fact, we'll be, I think, meeting with the building owner down there next week. I believe it's being set up now to go through and see exactly what that's going to entail.
And then I assume there's some specification in terms of evidence storage? for security in terms of, I assume you might have to build an area. I don't know, or if the building is just secure.
Yeah, we would actually have a fenced-in area, not unlike we have at the Law Enforcement Center, inside a secure, behind a locked door for evidence storage, and then that would be serviced regularly by our crime lab staff, who would come in there and take those items on a regular basis to process if necessary.
And finally, what would you envision, who are going to be, is there a nice line where you know what employees you would intend, what officers? Is it from a certain, sector of town that you're going to have work there? And are they going to be back at the main campus occasionally? How do you envision that?
So it is envisioned that the officers that are assigned to the southwest beats now, and that's typically everything, basically south of 26th Street and west of Minnesota, but it might not come that far. Again, there's a kind of a feel-out process to this too, but it's going to be the southwest units. And the only reason they would need to come to the station is for perhaps an administrative task or something like that. But the vast majority of their time, it is intended that they would report to work at that station in their personal vehicle, go in and get their uniforms on, get their shift briefing, get their equipment ready in their car, and start their patrol shift right there and end it back there.
Okay, thanks.
Any other questions? Anybody on the phones? Councilor Sale?
Yes, this is
None here.
Director Pritchard. If I could I just have one quick question. Holding an option to buy for a certain period of time is an asset. Do we revalue that asset every year?
No, we value it at the present value of that option at the very beginning. So we don't mark it to market like we would like our securities, where we say, okay, well, we think the value went up, so now we got to reset that amount on our financial statements. This is based on that specific option in that agreement for the $1.5 million. So we don't adjust for that. There shouldn't be much reconciliation if we did acquire the building. If we didn't acquire it, then we would have some reversing that would be going on. But you wouldn't restate its value.
And if we do not exercise, we certainly would then see a charge on we'd be giving up some asset if we did not exercise that.
You would be reversing it off of the sheet, yeah, so there would be a reversal of the asset and the liability.
But you don't have to do that. On a yearly basis, you do not have to revalue that asset. Okay, thank you.
I'm sorry, did I hear somebody on the phones? Did you have a question? Okay, apparently not. All right, I think that wraps it up for that presentation. Thank you very much. We'll move on to any public input if anybody, I don't know if they did leave, okay. All right, looks like we're pretty well cleared out, so we will adjourn till 7 o'clock. Thank you.